Dear students, welcome back. In the previous session, we have discussed about knee joint capsule. Now in this session, we are going to discuss about extracapsular ligaments. So normally, the ligaments of the knee joint consists of extracapsular ligament and intracapsular ligaments because of its attachments. So the extracapsular ligaments or the ligaments which are present on the outer aspect of the capsule. Okay, so mainly the extracapsular ligaments of the knee joint are tibial collateral ligament or medial ligament, fibular collateral ligament or lateral ligament, and anteriorly it is having ligamentum patellae, and posteriorly it is having two ligaments. One is oblique posterior ligament or oblique popliteal ligament and arcuate ligaments. So these are the extracapsular ligaments. Now we will see one by one. So the first ligament we are going to observe is the medial collateral ligament, which is present on the medial side of the knee joint. Okay, here this collateral ligament is a long band of great strength. Superiorly, it is attached to the medial epicondyle of the femur just below the adductor tubercle. Okay, and inferiorly, it divides into anterior and posterior parts. Okay, the anterior part is called as superficial part and the posterior part is called as deep part. Okay, the anterior part is about 10 centimeters long and 1.25 centimeters of broad. Okay, and it is separated from the capsule. These dotted lines or the capsule separated from the capsule by 1 or 2 bursae, and it is attached below to the medial border of the posterior part of the medial surface of the shaft of the tibia. Okay, so medial border and posterior part of the medial surface of the shaft of the tibia. Okay, so this band covers the semimembranosus muscle. Okay, and also some of the vessels and nerves, inferior medial genicular vessels and nerve. Okay, and this is about the superficial part of the tibial collateral ligament or medial ligament, and the inner one, the posterior part or the deep part of the ligament, is short and blends with the capsule with the medial meniscus. So it is blending with the capsule and also with the medial meniscus. It is attached to the medial condyle of the tibia above the groove of the semimembranosus. So this is about the tibial collateral ligament. If you see this fibular collateral ligament, it is a round cord-like structure and it is having an attachment above to the lateral epicondyle of the femur and below to the head of the fibula close to the styloid process. So this is about the lateral collateral ligament. Now we will see other extracapsular ligaments. Anteriorly, we can find the ligamentum patellae. It is attached above to the apex of the patella. Above to the apex of the patella. Below, it is attached to the upper half of the tibial tuberosity. So this is about the ligamentum patellae. Now we will see another ligament, that is oblique popliteal ligament. This oblique popliteal ligament or oblique posterior ligament, it forms the floor of this ligament forms the floor of 1/3 middle 1/3 of the popliteal fossa. If you see the attachments above to the lateral part of the intercondylar line of the femur and also area above the lateral condyle of femur. Fibers are directed downwards and medially and merge with the capsule of the knee. Okay, and some of the fibers are continuous with the insertion of semimembranosus tendon. So this is the attachment of oblique popliteal ligament. If you see the arcuate ligament, next extracapsular ligament, that is arcuate ligament, actually it is arising from the posterior expansion of the short lateral ligament which is present at the fibula. Okay, from there it extends backwards from the head of the fibula. This ligament extends from the head of the fibula, arches over the tendon of the popliteus, okay, and it is attached to the posterior border of the intercondylar area of the tibia. Okay, from fibula to intercondylar area, this ligament forms an arch-like structure which helps to pass out the tendon of the popliteus. Okay, and also as we know that the popliteus muscle is also originating from the, some of the fibers are originating from the arcuate popliteal ligament. So these are all about the extracapsular ligaments of the knee joint. In the next session we are going to discuss about intracapsular ligaments. Thank you.